Welcome back to the Glasses Guy channel. And once again, I'm here with all your tips and tricks for sunglasses and eyeglasses. Today, the format is going to be a little bit different, more of a webinar experience, but I've had several questions on progressive lenses specifically that I want to address today. So I'm calling this the subscriber FAQ for the Glasses Guy channel. And so we're going to talk about progressive lenses for just a few minutes and answer several questions that came in recently from subscribers. So let's get started. What is the possible field of vision range in today's lenses? What is possible with progressive lenses? Let's take a look at this graphic that will kind of unpack what's possible in today's lenses. And this lens we're looking at is one of the top grade lenses in the marketplace. So this lens is called Shamir Autograph Intelligence. And what it does is it allows almost full vision at the top for your distance, and then just a little sliver of distortion on the edges. The more you pay for the progressive, the wider that field of vision should be. And so ask, when you're buying a pair of progressive lenses, ask them how wide your progressive corridor is. So let me show you on this lens here and kind of draw it out for you. On the top, you're going to have that full range of vision, and then it's going to drop down here and kind of get to the point where you're getting a little bit of distortion on the edges, but you have this nice wide corridor to get your vision. And of course, you'll have the same on this side. And as technology develops, in one day, we probably won't have to worry about this distortion. But right now, the way that lenses are designed, there's going to be some distortion. But what you're paying for on the nicer lenses is that new technology that is widening your field of vision. And so that kind of gives you an idea of what's possible on today's lenses. And so ask how wide your field of view will be. One of the things to keep in mind is all the different brand names. I mentioned one called Shamir Autograph Intelligence. Well, that's just a brand name. So there are other lenses that are the similar or same quality, but they're called something different. So another one would be Essilor's lens. They have a new one called XR, and that technology is some of the best on the market as well. But those two lenses are going to be similar price points and also similar technology. Okay, so another question that came in recently is, if I can read fine when I take my glasses off, do I still need a progressive lens? Typically, I hear this question from people between the ages of 40 and 50. So you're kind of in between that range of, do I really need a pair of reading glasses or do I not? Most people are going to start wearing progressive lenses or some kind of reading power between the ages of 40 and 50 years old. But in this particular case, there are times where you actually can see fine to read without your glasses because you're looking through the distance in your lens. And so you're not able to read with your glasses, but as soon as you take those glasses off, you can read. And so this is a common challenge. In this case, I really recommend a lens called Eyezen Plus. Once again, that's a brand of this design. There are other types of plus boost lenses, but this is a certain brand called Eyezen Plus. What this lens does is at the bottom of that lens, you're getting a boost, some kind of add power, and it ranges based on your age and your needs, but you're getting a boost just down here. So you're getting full range of vision at the top and all the way down to the computer range. And then that lens is giving you that boost, or they call it like a comfort boost, where you're just getting the prescription or the add power that you need right there at the bottom of the lens. And so in the case of Eyezen Plus, you actually don't notice it that much. Like, it's not really obvious when you're wearing that pair of glasses. Just when you glance down, you're getting a little bit of boost. So it's not disorienting. It's not difficult because you don't get that distortion on the edges. You're just getting the boost where you need it. This is a great solution for those who are starting to, maybe your doctor's starting to talk to you about an add power or progressive lenses, but you just feel like you're still seeing fine when you take your glasses off. So in this case, you can do that Eyezen Plus lens. So you have your distance prescription where you need it. And then as you go down, that boost is at the very bottom. And often it's better for those people that aren't quite ready for a progressive lens because you don't lose any vision at the top or at that computer. You're just getting that boost that you need. So it's similar to a single vision lens, but it has some elements of that progressive. And so it's a good step up from a single vision to a progressive lens. So hopefully that helps. Ask your optician about it. It's certainly something we can do here at Enjoy Optical, and we can handle that remotely. If you ever want to try that lens, we can add it to a current frame that you have, or obviously you can buy another frame and put the Eyezen Plus lens in that pair. Okay, so for the last question, question number 3, what are the contributing factors to a positive progressive lens experience? And we addressed it a little bit in one of my videos, the progressive lens video, but I just want to clarify it and just put it in a few words here. The first factor is measurements. We have to fit each person uniquely. These frames on each person fit them uniquely. It might be a small difference, but where that pupil is sitting in the lens is so important to know. That way you can build the prescription around the pupil so you have optimal vision throughout that lens. And it's especially important in a progressive lens because where your eye sits is going to change based on the person and the frame. And so we need those measurements. Two of the most common ones are called pupillary distance, which you're taking for single vision lenses as well. That's the difference distance between your pupil and the middle of your bridge on each side, separating those, and you're able to get a PD measurement. The other measurement that is very important is called a seg height. And this is determining exactly where your eye sits in that lens as you're looking straight forward. And then you can also measure it at something called near seg, where you can actually look down and kind of see where your eyes are glancing when you go down as well. But the real crucial measurement is the PD, or pupillary distance, and the seg height, which you can take in a pair of glasses. The second factor is the correct lens design for you. And so, like we've talked about already, different progressive designs can be better for each person based on their desires and their needs. And that can be obviously budgetary. If you don't want to pay $800 for a progressive lens, then you can find a more budget-friendly lens. But you need to think about your lifestyle and are you on the computer a lot? Are you looking at your phone a lot? Are you really concerned with distance more than anything? And those are all factors or lifestyle questions that you really need to determine to decide on your lens design. And that's why having an optician or someone you can trust, even online, and that's what we're trying to do on this channel, is to create that space of trust where we can give you some advice based on your particular needs. Your brain is building new neural pathways. And so you have to be available and able to allow that to happen. And that can take a couple days. Now, obviously, if the other factors aren't in place, then your brain's never going to build those new neural pathways in a healthy way. But if the other factors are in place, then you're able to build the new neural pathways and your brain adapts to the new experience, and your eyes and your brain and all of those things come together to see well in a pair of progressive lenses. And the third factor is the prescription has to be correct. And that's really between you and your doctor and that experience in the optometrist chair or ophthalmologist, and they're writing that prescription based on your needs. And that can be wrong sometimes. And those things, your prescription can actually change based off of very strange factors, including certain meds you're taking or pregnancy or different factors in your life. So be aware of that as well. It may not even be the doctor's fault. There can be just some different factors that are affecting your vision during your exam, and that can produce a wrong prescription. So be aware of that as well. So the three things you must have: measurements correct lens design for you, the correct RX from the doctor, and then obviously your brain building those new neural pathways once all those factors are in place. So hopefully this has helped. Once again, these are subscriber frequently asked questions, and I just wanted to address them, and I want to be as helpful and create as much value as possible for my subscribers and for this channel. We want to help people around the world with their glasses because we love glasses, and we want to give you the best tips and tricks for sunglasses and eyeglasses. Share with a friend that might be able to use this information. We're here to help. Thanks so much for watching. Have a good day.